Okay, great.
All right, perfect. We are on, it looks like. And I want to say hello to everyone that's joining us today. Uh, Thank you for joining us at LAIVF Fertility Center this afternoon. You have joined our lunchtime webinar. Our topic for today is what to look for in a fertility clinic. We just to let you know, we are LAIVF. We specialize in advanced fertility care to help you achieve your goal of becoming a parent. You can learn more about us on our website at laivfclinic.com. My name is Araba. I am the Practice Relations Director. And joining me today is Dr. Akut Bayrak. He is the Medical Director, founder, and owner of LA IVF Fertility Center. Dr. Bayrak has been in private practice since 2005 and is double board certified fertility specialist. Welcome, Dr. Bayrak.
Hello, Arba. I think I need to just set up my video
Oh,
here. Okay, perfect. Great.
okay.
So it's great to be doing another webinar today. And it looks like we have some guests already in the chat room.
Yes.
That's wonderful. So I think today's topic is
Mhm.
about what to look for when you are searching for or looking for a fertility clinic. And there are many things that one can look at, obviously. One of the most important thing is, I think, when to look for a fertility clinic as
Yeah.
opposed to what to look for in
Mhm.
that clinic or which one to choose. And just in terms of some general information, if somebody, a couple, is interested in fertility and they've been trying for a certain period of time, then that would be a good time to search for a fertility clinic. Just as a general approach, if somebody's trying for about a year with unprotected intercourse and at a certain frequency, then an assessment and evaluation by a fertility specialist is recommended. So, and the most recent recommendation is that if the female partner, if the woman is less than age 35,
Mhm.
and unless there are some obvious problems like lack of sperm or an ovulation issue or known pelvic problems or known tubal damage, for example, then we do recommend for 1 year of unprotected intercourse before starting any kind of workup. And that's for women less than age 35. So if somebody is over the age of 36, then that duration is actually shorter, and it's only 6 months. So if we have a 38 or 42-year-old, 43-year-old trying for 6 months or 9 months, we don't really tell them to wait for a whole year because majority of the pregnancies are seen within 6 months. Although it is possible to get pregnant, obviously, after the 6 months, majority of the time it doesn't happen. And because time is an issue and is of essence in those patients, we really don't wait for another year or two to start the work, but rather start the workup after about 6 to 9 months max. So that will be a time to search for a fertility clinic. If you're under the age of 35 for the female side, for the women, and you've been trying for a year, then that is the time to call a fertility clinic and schedule a consultation. So the fertility doctor can do a workup on you and identify the underlying cause of your infertility. If you're over the age of 36, including 36 and up, then you try for 6 months, 6 to 9 months max. And after 9 months, if you're still not pregnant, you should absolutely schedule a consultation with a fertility clinic. Obviously, these exclude certain conditions where there's a known problem. Let's say if somebody's not ovulating, your cycles are every 3 months, or you're not getting your periods at all. Obviously, you're not going to wait for a whole year. You're not going to wait for 6 months. You're going to come in right away to a fertility clinic so we can assess you and find out what the problem is. If there's a known issue where the tubes are damaged, the tubes are missing because of previous infection or surgery, whatever the issue may be, you're not going to wait for a whole year, because if your tubes are missing or they're diseased or they're blocked already, and we know that, obviously you're not going to get pregnant whether you try for a month or for a year or 2 years. If there are major sperm problems that we already know, then obviously we're not going to wait for a year. So if everything is somewhat normal to our knowledge, then you try for 6 months, less than age 35. After 36, you try for, I'm sorry, for less than 35, you try for a year. And then over 35, you try for about 6 to 9 months, and then try to find a fertility clinic. And I think the next question is, what to expect from that process. The consultation is typically, at least in our clinic, at least an hour, sometimes a little over an hour, so we can identify the problem. We have a very detailed questionnaire, so we understand what the underlying cause is, sometimes just by history alone. If not, we do hormone testing to understand if the egg reserve is good, if there are no hormonal problems. Our routine is to test the sperm with the semen analysis and identify any pelvic issues by doing an X-ray to check the fallopian tubes, and that's called an HSG test. So this is our basic workup that we do on everybody. But if there is an issue, then we do additional testing, and that's called advanced testing or screening.
And
In terms
Dr.
of,
Byrak,
yeah,
can any of those testing be done at their original OB or OBGYN, or is all of that done with a fertility specialist with us?
some of those tests can be done through the OBGYN. So, for example, like the blood testing can be done by the OBGYNs. The X-ray can be ordered by the OBGYNs. The semen analysis, which you do in our laboratories, can be ordered by the OBGYNs. So all of those can be done through the OBGYNs even before coming to us. And sometimes they are actually. So sometimes when the patients come in, their workup is either complete or partially complete. So that all of that then can be done certainly through the OBGYNs. The things that we do are a little more advanced, obviously. So the hormone testing is something that we do on everybody. And then the ultrasound is done specifically by the fertility doctors, because we want to see how the egg reserve is, how the ovaries are, whether there are any cysts, if there are, what type of cysts they are, shape and position of the uterus, if there are any fibers or not. So that is an advanced ultrasound, and excuse me, and ideally that should be done by a fertility doctor, because we do look at many other aspects of the ovaries and the uterus, where just a routine gynecological ultrasound may not concentrate on those aspects of the anatomical findings. So ideally, I recommend ultrasound to be done by the fertility clinic, where blood work can be done anywhere, obviously. So those are some of the things that we do and recommend. And I think in terms of the, in terms of which clinic that you need to choose or what to look for in a fertility clinic, is number one, probably proximity. So if you live in an area like Los Angeles or major metropolitan areas, there are a number of clinics that are available to patients. If you live in a rural area, or if you're living in a suburban area or an area where there aren't that many fertility clinics, then you try to find the closest one to you. And if there isn't, then you may need to travel to a fertility clinic to receive fertility services. So let's start with the easy one, which is metropolitan areas such as Los Angeles, which is where we're at, or Southern California, where you have a lot of different options. So I think the things that immediately one can look at are, number one, is that clinic a reputable clinic? Does that clinic have good reviews online? Does the clinic have a board certified physician or physicians? Does the clinic have their own IVF laboratory? That doesn't necessarily mean that they have to have a laboratory in each location, which would be almost impossible to do, but do they have a location where they have their own laboratory? Do they have their own andrology laboratory? Do they have their own surgery center? Do they have their own tissue bank where they do almost everything in-house? So I think that's very important when you're selecting a fertility clinic, where All of those can be done under the same umbrella. Oftentimes, at clinics where there's more than one location, um, certain visits and ultrasounds and follow-ups and everything else can be done in those locations, which is also what we have, certainly. And then the procedures are typically done in one or two locations, which also is what we
Mm-hmm.
typically offer. So that's probably one of the most important factors when you're looking for a fertility clinic: a physician who is fellowship trained in reproductive
Mm-hmm.
endocrinology and infertility, and furthermore
Mm-hmm.
board certified in reproductive endocrinology and general obstetrics and gynecology. So when you go to a fertility clinic, you're getting more
Mm.
advanced care, and you want to make sure that you're receiving that advanced care by somebody who has completed additional training in infertility and reproductive
Okay.
endocrinology. So that's
Mm-hmm.
very important. The other important variable is the laboratory. Who is running that laboratory? Who are the embryologists and who are
Mm-hmm.
the lab directors? So each laboratory should have a lab director, and that can be
Mm-hmm.
on site or that can be off site. So what that means is, if the lab director is on site, which means they are actually in the
Mm-hmm.
laboratory, majority of the time that means that they actually do the
Mm-hmm.
hands-on work as well as being the laboratory director. We have been fortunate enough that from day one, we had our lab directors
Mm.
on site and hands-on, and that's the way that we prefer things to be done, because the lab directors are typically
Mm-hmm.
PhD level individuals who have vast training in embryology and experience, but they're also competent in high
Mm.
complexity laboratory procedures and services. Currently, we actually have two PhD individuals who are working at our laboratory, and we also have other embryologists working in our laboratory at the same time. And we believe that's a better type of a setup for an embryology laboratory, because our laboratory director is actually on site and
Mm-hmm.
full time. I think that is probably one variable that does differentiate us from some of the other
Mm-hmm.
laboratories in the country, where sometimes we see laboratories that only have the
Mm-hmm.
embryologist on site and the laboratory directors are off site, which is also okay. But our preference is really for the laboratory director to be on site, hands on, working with the rest of the embryologists, so they see over the operation day
Mm-hmm.
to day, and they're kind of more hands-on. And our embryologists are actually probably one of the most experienced in the world, who have done many IVF and egg freezing studies and published. And I just have really vast experience in laboratory procedures. So we really have been lucky and blessed, I have to be honest, that we really have a very, very experienced and hands-on embryologist. So that's one important thing to look for when you're searching for a fertility clinic, whether the embryologist is actually on site and the lab director is on site and hands-on, where they can provide services. We believe that also creates a better
Mm-hmm.
continuity of care. The other things that one can look at is the clinic providing services under certain physicians, or is there's a rotation. So in our clinic, our approach is that one physician takes on a case and does all the procedures, ultrasounds, follow-ups, including the pregnancy ultrasounds. And so from start to finish, one physician follows that patient. Understandably, we have, of course, surgeries or emergencies that can come up, or certain situations where another physician may cover the patient where the primary
Mm-hmm.
physician is not covering, but that is a very, very rare event. So when patients cycle at LAIVF, typically they see the same physician throughout um, throughout their treatment, from the initial consultation to the exit, which is their graduation when they become pregnant and exit our practice to go to their general OBGYN. And our system allows us to design their protocols and treatments so that one physician takes care of them from start to finish. And we truly believe that is a better level of care. We truly believe that's better for
Mm-hmm.
continuity of care, and especially in what we do, which is a highly specialized part of medicine, and it's a subspecialty within OBGYN that we believe the care is improved in that sense. Also in our clinic, which is one important thing that one should look at when searching for an IVF center, is that the physicians actually do all the ultrasounds. And we also believe that is beneficial for the patient because that physician always does the ultrasounds. So that's also better continuity of care, where we every single visit, whether that's IVF or IUI or any other treatment it might be, also provides better continuity of care. The when the ultrasounds are once again done every single visit, the same physician sees the patient, we truly believe the outcome can actually be improved that way as well. So we don't really have sonographers or ancillary staff providing those services. So the physician really sees the patient every single time, and patients highly appreciate that. Actually, over the years, I've gotten excellent reviews and also great feedback with this approach that we have incorporated. Also, in terms of our approach to the patient, we believe each patient is an individual that desires individualized care. So we don't have one size fits all kind of an approach where there's a certain protocol that patients are placed on. We take each case seriously and customize their protocols, especially for IVF treatments. Patients are assessed, examined, all have a follow-up consultation, which then results in the planning of their IVF cycle and protocol. And the last not least is we are in 4 locations in Southern California, as some of the attendees may already know from our website. West LA or Beverly Hills location is 1, Pasadena. The Inland Empire location is in Chino Hills, and we also have a location in San Diego. So patients are seen in any of those locations, and they're provided same level of care. So that is also, I think, one major advantage that we do offer, and that's something that the patients should look into if and when they're searching for a fertility clinic. So let me stop here and maybe answer some questions that are above from you, or some of the questions that are coming in, it looks like, and because we have another 10 minutes to wrap things up, it looks like. So let me stop at
Well,
this stage.
I do. We have somebody who's asking about the process. If they have their tubes tied and they have no other issues, what does the process look like as far as getting testing and so forth?
So if somebody has their tubes tied, there are 2 options basically. One is to have a tubal reversal, which is a type of surgery, which is something that we perform, and not too many places offer that surgery, as a matter of fact. And it's really sad that most infertility doctors actually are no longer trained in it. So I actually did my fellowship at USC, University of Southern California, where we did a large number of those cases. So I'm very comfortable in doing those surgeries, where we do perform a type of surgery that's called laparotomy, which is making a very small incision in the lower abdomen, approximately about 6 centimeters. That's less than about 3 inches, probably about 2 to 3 inches. And through that small incision, we're able to pull the tubes up into the skin and then open the edges and reconnect the tubes. That's called tubal reanastomosis or tubal reversal. And it's an outpatient surgery. We actually do that in our West Los Angeles location, where we have our own surgical center. So because we have our own surgery center, we have the luxury of doing everything in-house, where we can offer actually very competitive rates for these surgeries because it's a self-pay type of a surgery. Almost always these surgeries are not covered by insurance. And it's an outpatient surgery. Patients come in very early in the morning. We do the surgery. It takes about an hour and a half. It's a very low-risk surgery, and it's quite successful if the female partner is healthy and young, and if the male partner also has good sperm and healthy and also young, obviously. So that would be one option. Recovery is very quick, and within 6 weeks, actually, they can start trying. And that is one available option if your tubes are tight. The second available option is obviously IVF, in vitro fertilization, which significantly increases their chances over tubal reversal. So IVF is actually much more successful in these patients. Um, but it doesn't have to be IVF. It also can be tubal reversal, of course. And IVF is a totally different type of treatment, which I think goes past beyond this webinar today. So I don't want to spend time on that. But that's more of a medical treatment where patients take hormones, create multiple eggs, and then create embryos, and we do the transfer one embryo into the uterus, and that's how you get pregnant. Versus the tubal reversal, which is a surgical type of treatment, which also certainly accomplishes a certain percentage of success. What I would recommend for this question is we can actually offer her a consultation, and we do a lot of video consultations because we have a lot of out of state, out of country, out of town patients that we treat. So I would highly recommend that she schedules a video consultation with me so I can talk about all the pros and cons and the details of these options, because once again, that will take quite a bit of time, and we don't have a whole lot of time on the webinar today to spend on that topic. So I would highly recommend that this patient schedules a consultation.
Okay, fantastic. Thank you. And I just want to put out there one more time that we're open to any questions that anybody has. But I also want to remind everyone that by joining our webinar today and any of our webinars, if you join us for the entirety of the webinar, then we give you a free consultation to see Dr. Byrak and to meet with him, either, as he said, via video or coming into our clinic. And I will give you all of that information through the email that you signed up with after the webinar. So you'll get that information as well. And it looks like there are no other questions that I see. So I think we're okay to wrap up for this afternoon. And I just want to say thank you so much, Dr. Byrak, for explaining.
Thank you so much.
Great. Well, have a wonderful day, everyone.
Thanks again.